and welcome. In this video, we will talk about how to recognize the signs and symptoms of bowel cancer. It's important to be aware of changes in your body and consult a healthcare professional if you notice any concerning symptoms. Early detection can make a huge difference, so let's dive into the key warning signs. 1. Changes in bowel habit. Changes in bowel habits are often one of the earliest and most noticeable signs of bowel cancer. These changes can manifest in different ways and may vary from person to person, but common symptoms to watch for include frequent diarrhea. Diarrhea is defined as passing loose, watery stools more than 3 times a day. Bowel cancer can affect the movement and function of the intestines. Tumors in the bowel can cause irritation, which leads to increased bowel movements and diarrhea. This can be especially noticeable if it becomes more frequent over several days or weeks. If diarrhea persists for more than a few weeks, or if you notice blood in the stool along with diarrhea, it could be a sign of an underlying issue, including bowel cancer. Constipation. Constipation refers to difficulty passing stools, often accompanied by straining, infrequent bowel movements, or a feeling of incomplete evacuation after using the bathroom. A tumor in the colon or rectum can cause a blockage or narrowing of the bowel, making it harder for stools to pass. This leads to constipation and may cause discomfort and bloating. If constipation is persistent or lasts for more than a few weeks, especially if it comes with other symptoms like blood in the stool, abdominal pain, or unexplained weight loss, it should be investigated. Alternating between diarrhea and constipation. Some people with bowel cancer may experience alternating periods of diarrhea and constipation, often without any clear cause. This can create irregular bowel movements, where sometimes you feel the urge to go frequently, while other times you may struggle to go at all. As the tumor grows and obstructs parts of the bowel, it can disrupt normal bowel function, leading to inconsistent bowel movements. When should you be concerned about changes in bowel habits? If changes in bowel habits persist for more than a few weeks, they should be evaluated by a healthcare provider. If you also experience other symptoms, such as blood in your stool, unexplained weight loss, abdominal pain, or fatigue, this combination of symptoms should prompt a visit to the doctor. If the changes are severe, like constant diarrhea or constipation, or if they affect your quality of life, it's important to seek medical help. If you notice any of these changes, it's essential to keep track of your symptoms. Write down the changes you've noticed, including their frequency and any other accompanying symptoms. Visit a healthcare provider. Early detection of bowel cancer can significantly improve treatment outcomes. Your doctor may recommend tests like a colonoscopy or imaging studies to assess your bowel health. Don't ignore persistent changes. Even if the changes seem mild or temporary, it's always better to err on the side of caution. Changes in bowel habits can be a sign of many different health issues, not just bowel cancer. However, if these changes persist or are accompanied by other concerning symptoms, it's important to get checked out by a healthcare professional. Early diagnosis and treatment of bowel cancer can make a significant difference in the outcome. 2. Blood in stool or rectal bleeding. Blood in the stool or rectal bleeding is one of the most concerning symptoms of bowel cancer. It can appear in different forms and may indicate various underlying conditions, including hemorrhoids, anal fissures, or infections. However, persistent or unexplained bleeding should always be evaluated by a healthcare professional. Fresh, bright red blood is usually seen on toilet paper after wiping, in the toilet bowl, or coating the stool. Hemorrhoids, swollen blood vessels in the rectum or anus, anal fissures, small tears in the anal lining, rectal polyps, lower gastrointestinal, GI. Bleeding from the rectum or lower colon. If the bleeding persists, worsens, or occurs with other symptoms like weight loss, abdominal pain, or changes in bowel habits, it could indicate bowel cancer or another serious condition. Bleeding from higher in the colon or small intestine. Diverticulosis, small pouches in the colon that can bleed, inflammatory bowel disease, Crohn's disease, or ulcerative colitis, bowel cancer. This type of bleeding is more concerning than bright red bleeding because it often originates deeper in the digestive. If it persists or is accompanied by other symptoms, see a doctor. Blood in the stool or rectal bleeding is not always caused by bowel cancer, but it should never be ignored. If the bleeding is persistent, unexplained, or comes with other symptoms like weight loss or changes in bowel habits, consult a healthcare provider as soon as possible. Early detection of bowel cancer greatly improves treatment success and survival rates. 3. Unexplained weight loss. Unexplained weight loss is another possible sign of bowel cancer. If you are losing weight without changing your diet or exercise habits, it could be a red flag. It's important to discuss this with your doctor, especially if you have other symptoms. 4. Abdominal pain or discomfort. Persistent abdominal pain or discomfort, especially if it's accompanied by bloating or cramping, can also be a symptom of bowel cancer. If you experience this regularly, it's essential to get checked out. 5. Fatigue or weakness. Fatigue or weakness, especially if it's severe or unexplained, may occur in people with bowel cancer. This could be due to anemia caused by internal bleeding. If you feel constantly tired, consult a doctor. If you notice any of these symptoms, it's important not to panic. But it's equally important to get checked by a healthcare provider. Bowel cancer is often treatable, especially if caught early. Your doctor may recommend tests such as a colonoscopy to determine the cause of your symptom. Thank you for watching. Early detection and regular screenings can save lives. If you have any concerns or symptoms, don't hesitate to reach out to your healthcare provider. Take care of your health, and don't ignore the signs.
Thank you for watching. If you like the video, please share it with your friends. And please subscribe to our channel if you already haven't done so.